Hi everyone, this is Francesca from Social Work Portal. In this video, I'm going to show you how to write flawless case notes. And I mean really good ones that are clear, defensible, and actually useful to anyone who picks up that file later. You'll learn the 4 most widely used case note formats in social work and behavioral health: SOAP notes, DAP notes, BIRP notes, and GIRP notes. For each one, I'll explain what it stands for, when it works best, and I'll give you a real example that you can model your own notes after. And if you hang out through the end, I'll show you where you can find free and downloadable pre-formatted case notes. Now, before we get into the specific formats, let's talk about what every strong case note shares, because the foundation is the same, regardless of whether you're writing a SOAP, a DAP, a BIRP, or a GIRP note. Here's 4 things to remember. Timely, meaning you write it as close to the session as you can. Specific, meaning you replace vague language like good session with actual observable detail. Separated, meaning you're keeping what the client said or what you observed clearly distinct from your clinical interpretation. And actionable, every note closes with a clear next step. Why use standardized case note templates instead of just jotting down a free-form note? Well, research shows that using optimized templates saves caseworkers an average of 2.6 hours per day, or roughly 23 minutes per client encounter. That's pretty significant. A consistent case note format is one of the most effective tools for saving time, as well as ensuring all the important things are captured every time you write a note. Let's start with the SOAP note, which is the most widely recognized case note formats across social work, mental health, and clinical documentation. SOAP stands for subjective, objective, assessment, and plan. Here's how each section works. Subjective is everything the client reports in their own words: their mood, their complaints, their goals, any quotes you want to capture. Objective is limited to what you directly observed, how they presented, their effect, whether they made eye contact, anything measurable or observable. Assessment is where you put on your clinical hat and interpret what the subjective and objective sections mean together. And plan is the concrete next step. For example, a referral, a follow-up date, or a resource you're providing. SOAP notes are the go-to for hospital social work and clinical mental health, and really any setting where your notes will be read by medical professionals. If you're collaborating with a physician or a psychiatric team, SOAP is going to be the format that they often expect. So let's do a quick example of a SOAP note. Here I'm in the Case Management Hub software. I'm going to add a note, and I'm going to choose the built-in SOAP template. It's already set up with each of my 4 sections. For subjective, I'll say the client reports feeling less anxious this week and sleeping better. Now comes the objective. Client was calm, engaged, and participated throughout the session. Those are my objective observations. Next is the assessment. Based upon the first 2, symptoms appear to be improving with continued coping skills use. Now for the plan. What are the next steps? Continued weekly sessions and practice relaxation techniques daily. Now let's go on to the next one. Next up is DAP, Data, Assessment, and Plan. Think of DAP as a streamlined version of SOAP. The key difference is that the DAP note combines the subjective and objective sections from SOAP into one, the data section. This means that you get to the clinical interpretation faster. That's what makes the DAP a really practical choice for high-volume settings, community mental health programs, outpatient therapy practices, or nonprofit case management teams. Wherever you're seeing a lot of clients and need a format that moves efficiently without cutting clinical corners. So let's take a look at a sample. Okay, back in our case management system, we're going to add another note. This time we'll use the DAP template. First, the data. The client discussed difficulty managing stress at work and recent conflicts with coworkers. And the assessment. Client demonstrated insight into stress triggers and remained motivated to improve coping skills. And now for the plan. Review communication strategies next session and encourage daily stress management techniques. You can see how the DAP is a bit snappier than the SOAP to fill out. The DAP is a solid first choice for new practitioners who find the SOAP format a little rigid, because the combined data section is more natural to write in most conversational clinical encounters. Next, we have the BIRP note. BIRP stands for Behavior, Intervention, Response, and Plan. This format was built specifically for behavioral health settings, and it's the go-to in substance use treatment, residential programs, and mental health crisis services. Here's what makes the BIRP format different from SOAP and DAP. It has a dedicated intervention section, which means you're explicitly documenting what you did in this session. Which therapeutic technique did you use? Did you use motivational interviewing, CBP, reflective listening, psychoeducation? And then there's the response section that captures how the client actually responded to that intervention. So here I'm looking at my overall notes table in this case management tool. I'm going to take a look at this BIRP note. I can see each of the 4 sections: behavior, intervention, response, and plan. So let's say Casey is a substance use counselor. His client came in after a relapse, minimizing it and expressing frustration with recovery. In his BIRP note, Casey didn't just write down what the client said, he documented what he used: motivational interviewing, as well as reflective listening. He used those to validate the client's frustration, and then recorded that by the end of the session, the client had identified 2 personal motivators for continuing. That documentation of specific interventions and the client's response is exactly what funders, billing departments, and clinical supervisors often need to see. If your setting has any kind of productivity or outcomes reporting, the BIRP is often the clearest way to demonstrate the clinical work you're actually doing. And the last note we're reviewing is the GIRP, which stands for Goal, Intervention, Response, and Plan. You'll notice that 3 of the areas are the same to the BIRP, but this one starts with Goal. And as you can imagine, it's the most goal-centered note type of all the 4 formats. Every GIRP note starts by anchoring the session to a specific, measurable objective, already documented in the client's treatment plan. This is what makes GIRP a natural fit for community mental health programs, rehabilitation services, and any program with funder reporting requirements where you need to demonstrate measurable client progress over time. If your agency gets funding tied to outcomes, GIRP makes a connection between the sessions and treatment goals in every single note. And here's a quick example of a GIRP note. The patient's goal is to increase healthy coping skills and better manage anxiety. For the intervention, counselor taught grounding techniques and practiced deep breathing with the client. Response: client actively participated and reported feeling more confident using the new coping strategies. And the plan: practice grounding exercises daily and review progress at the next session. As you can see, each of these templates, as well as several others, are baked into this Case Management Hub platform. I'll tell you how to get a free trial shortly. Okay, so now that you know all 4 note type formats, how do you actually choose? Here's a quick decision framework. SOAP for clinical and medical settings. DAP when you're moving fast and need efficiency without sacrificing structure. BIRP when you're in behavioral health or substance use, and you need to document specific interventions for billing or outcomes. And GIRP when your program is goal-driven and you need to tie every session directly to a measurable treatment plan objective. Your agency's compliance requirements and funder reporting needs will often make the decision for you. So always check those first before picking a note format based on personal preference alone. And now that you know about these 4 excellent note types, where can you get them? Just click the link in the description and sign up for a free trial of Case Management Hub. And you can keep your credit card in your wallet. It's not needed for the free trial. Then once you sign up and land on the main dashboard, look for Add Note in the Quick Actions. Click that and then click the Note Types drop-down to choose the note template you'd like. You'll notice the templates will also have some tips to get you started. Thanks so much for hanging with me and watching my video. If you like this type of content and want to learn more about social services and nonprofit tools and resources, like this video and subscribe to our channel. You'll never miss one of our new exciting videos.